Hello friends, this is Samanpreet. Welcome to my channel, soon to be Nurse Preet. I have a homework to do from a university, that is a virtual simulation for my 4th year of nursing, and I thought we all can do it together. Let's do it. The simulation is about Mr. Emoto's acute exacerbation of congestive heart failure, and here is the video and I will go through it. So according to this, Mr. Emoto is a 67-year-old gentleman and he lives at home alone. He called extramural for the shortness of breath over the past few weeks, and he's concerned about today because he's having difficulty ambulating from couch to the washroom without significant dyspnea. On the background profile, the nurse collects reading Mr. Emoto lives alone with his cat as his wife passed away 6 years ago. During the call to the EMP, he indicated that he is having a difficulty ambulating from couch to the washroom without profound dyspnea. And the nurse noticed increased work of breathing and he was speaking in broken sentences. So our question is, what aspects of health history should the nurse explore first? And there are 4 options. General overall health state with the focus on respiratory and cardiac systems. And option C is complete an assessment on respiratory and cardiovascular status. And I would go with option C, general overall health state with the focus on respiratory and cardiovascular system. Let's see what's the answer. Excellent, and our answer is correct. Our next question is, which of the following components of the health history should the nurse explore first? Options are onset, intensity, previous health history, precipitating factors, and medication reconciliation. I would go with onset and intensity. And what are the other factors? And here we go. Our answer is right. And next question is, upon realizing Mr. Emoto has not taken his medication in 10 days, what should the nurse consider first? Option A, medication compliance, social determinants of health, and income. Medication compliance, I will go with social determinants of health because he already told us that he's not taking his medication. So we need to know why he's not taking his medication. It could be financial, or he's thinking he doesn't need to take medication, or he can't access it. So I will go with social determinants of health. And the response is correct. Question is, how should the nurse respond to Mr. Emoto's request to keep this information confidential? And option 1 is, does your family know how you feel about keeping information from them? Option B, sorry, this information must be shared with your children. I will not disclose information to your neighbors. And option C is, it is your right to make decisions about your personal health information. And the correct answer is C, because it should be confidential, right? So I'm going to go with option C. It's your right to make decisions about your personal health information. And here we go. Our answer is correct. Next question is, in addition to shortness of breath on exertion and pedal edema, what are the expected clinical findings consistent with an acute exacerbation of heart failure? There are 3 options. Option A, unable to walk up a full flight of stairs without experiencing shortness of breath, persistent cough for 2 weeks and difficulty sleeping at night, crackles escalator bilaterally. I think we already talked about shortness of breath, so option C is correct. I think I will go with option C, crackles escalator bilaterally, because the fluid is accumulated in your lungs, so that's why you can hear crackles when you're checking the lungs. That is correct.
I think we need to get you into the hospital to get you feeling.
Okay, next question is, what education should the nurse provide to the client at this time? The nurse should prioritize the need to discuss. Option A, management of acute exacerbations of heart failure. Second, self-treatment at home. Third, medication regime. I will go with management of acute exacerbations of heart failure. And guess what? Our answer is correct. So next scenario, nurse is calling the 911 and our next question is, nurse recognizes Mr. Emoto's work of breathing is increasing. What nursing intervention may be helpful to implement until EMS arrives? Encourage Mr. Emoto to finish quickly so he can rest. Sit Mr. Emoto in a chair. Help Mr. Emoto lie down on a couch. No, we can't lay him down because that's gonna make his breathing worse, right? So we gonna sit him in the chair. So sit Mr. Emoto in a chair. That will help with the shortness of breath. Outstanding, and we have chosen the correct response. And the next video is that EMS arrives and they're gonna check Mr. Emoto and everything. And after the video, there's a question for us. How would the nurse structure a thorough handover to EMS? Nurse uses SBAR format to provide report to EMS. Nurse provides only assessment and recommendations. Nurse states report was given to emergency department. And in nursing, we always use SBAR when we give reports. So we choose nurse uses SBAR format to provide report to EMS.